Carol Baskin thought it was a good idea to find a new companion. She searches on the internet and sees that there's a German Shepherd available for her. She goes to Humane Society and finds the perfect companion and is completely in love with their German Shepherd called Lady. Lady is a German Shepherd, black and tan, female, spayed, fully vaccinated, and her date of birth is 2/29/2009, which makes her 8 years old. 2 years later, Carol started noticing that Lady has been drinking out of her water bowl more frequently, only to go in the backyard and start peeing in small spurts everywhere in the backyard. Carol starts to worry when Lady has frequent accidents inside of the household and her urine has a very strong odor. When getting touched in the abdomen, Lady would cry and yelp. The next day, Carol decides to take Lady to the veterinary hospital and get a checkup. Upon being in the exam room, Mrs. Baskin has been explaining to Dr. Joe and the registered veterinary technician, Anna, what has been going on with Lady for the past 3 days. Dr. Joe then takes a physical exam on Lady. He mentions that everything seems to be normal besides the fact that she has a very red, puffy, and irritated vulva. Mrs. Baskin hands over the urine and fecal sample that they asked for. Dr. Joe then asks if it is alright to do an ultrasound on Lady before heading in. The registered veterinary technician does the diagnostics, first for the specific gravity, then the dipstick. She then makes her fecal float and looks under the microscope for the urine and fecal slides. The results comes back normal besides the rods, cocci, and fungi. Then Dr. Joe does his ultrasound to look at her organs. Everything is normal besides the slight inflamed urinary bladder.
1 hour later.
Hey, is Lady doing okay? Everything alright? Hi, Miss Baskin. Actually, everything came back completely normal. She's just fighting an infection going in her urinary bladder right now, and it's pretty common for dogs, especially the environment that they live in. It could occur from bacteria going in her urethral opening, from dirty grass, her own feces, other dogs' feces, or dirty water, and it just infests in there. But we're gonna go ahead and give you guys Clavamox. It shouldn't last for more than 14 days, and it's gonna be taken with food twice a day. And if her symptoms don't go away, then we can go ahead and prescribe you guys some more. But we're gonna do a follow-up appointment as soon as you guys are done with the medication, okay? Okay. Is there anything else I should be worried about? No, you're all set. She's actually good to go home. Thank you so much for your help. Dr. Joe comes back in the exam room and confirms that Lady is a healthy dog. He didn't find anything too significant during the ultrasound except that her urinary bladder was slightly inflamed. But she was good to go home. Miss Baskin comes back with Lady for their follow-up appointment 2 weeks later and mentions that Lady's symptoms started to get better after 1 week of her medication. She mentions that today Lady has been drinking and urinating normally again and is back to being a happy dog.